Are you interested in a Medicare Advantage plan, but you don't know where to start? Or are you just looking to make the most of this AEP with regards to your current Medicare Advantage plan? Well, in today's video, we've got you covered. We'll go over the basics of Medicare Advantage, the pros and the cons, Medicare Advantage versus Medigap, changes for 2026, and most importantly, we'll teach you how to navigate Medicare.gov to make the most of your AEP. Stay tuned. First, let's start with the Part C, or Medicare Advantage Basics. Now, if you're already familiar with Medicare Advantage and you're really looking for some of that additional content regarding Medicare.gov, make sure to check out the timestamps in the description below so that you can feel free to jump ahead. So Medicare Advantage, as I mentioned, is also known as Medicare Part C. Medicare Advantage is actually a replacement for or alternative to Original Medicare. That means that you can't have Original Medicare and Medicare Advantage at the same time. Medicare Advantage must offer at least the same benefits as Original Medicare, but many Medicare Advantage plans choose to offer additional benefits as well to entice beneficiaries. Most commonly, these would be things like dental, vision, hearing, and prescription drugs. Because yes, remember, Original Medicare doesn't really cover prescription drugs, except with some very limited exceptions. Now, Medicare Advantage is offered by private carriers, which means that benefits and copays and coinsurance costs can vary widely. However, Medicare Advantage is not the same as Medicare supplement plans, which are also offered by private carriers. More on that in just a moment. First, let's talk about some of those big changes coming to Medicare Advantage in 2026. More flexibility in plan designs in certain states, new telehealth coverage options, which is being largely eliminated with Original Medicare, changes to cost sharing limits, and expanded coverage for certain preventative services. Now, with over half of Medicare beneficiaries currently enrolled in a Medicare Advantage plan, it really has been a very hot button topic in Washington as of late. And there is a lot of proposed legislation that may change the face of Medicare and Medicare Advantage in the future. So please make sure to stay on top of any of these updates so that way you make sure that your plan is not being affected. That being said, although we do expect to see some expanded benefits in this year, at least 2026, we do want to let you know that Aetna, which is a very, very large insurance carrier, is actually pulling out of a lot of its Medicare Advantage plans. And this may have ripple effects on other carriers in the years to come. And that leads me to the pros and cons of Medicare Advantage plans. It's very easy to see the appeal of Medicare Advantage plans. Perhaps that's why over half of Medicare beneficiaries are enrolled in some type of Medicare Advantage plan. But it's very important that you take a critical eye to Medicare Advantage versus Original Medicare to determine which is really best for your needs. So although many Medicare Advantage plans do choose to offer additional benefits like dental, vision, hearing, and prescription drug, it certainly comes at a cost. And no, I'm not necessarily meaning a financial cost, because many Medicare Advantage plans are actually offered with no additional charge. Now, that doesn't mean that there is no charge whatsoever. Even those plans that claim to be free, spoiler alert, they're not. You will still have to continue to pay for your Part B monthly premium, even if you don't have to pay anything additional. Now, the real downside to Medicare Advantage plans has to do with their restrictive networks and the issue of pre-authorization. So Medicare Advantage plans, unlike Original Medicare, operate on networks. You can choose between an HMO and a PPO. We highly recommend a PPO for more flexibility. However, you're still not going to have the same flexibility as with Original Medicare. And those networks could possibly be shrinking as more and more doctors and hospitals are jumping ship because they find the issue of pre-authorization with Medicare Advantage just too restrictive. So please make sure to think ahead and not just look at those additional benefits like fitness to determine whether Medicare Advantage is right for you. The reason we want you to look ahead has to do more with Medicare supplement plans than with Medicare Advantage plans themselves, because these are really the two main paths that you could choose to follow with Medicare. You could choose to forego Original Medicare and opt for a Medicare Advantage plan, hopefully one that includes prescription drug coverage instead. Or you could choose to stay with Original Medicare and supplement your coverage with a Medicare supplement plan and, of course, a Part D plan for those prescription drugs. Now, these two options are understandably easily confused, but they're really not the same. Medicare Advantage plans, as I mentioned, operate within networks. Medicare supplement plans don't operate within networks, even though they are offered by private carriers. They are really just a financial solution to fill in those out-of-pocket costs associated with original Medicare. So basically, you'll still be able to see your doctor or go to the hospital that accepts original Medicare, but instead of paying a copay or a coinsurance, your Medicare supplement plan will step in to fill those out-of-pocket costs. They won't offer additional benefits like dental, vision, hearing, or prescription drug. They will just give you more flexibility and more financial security than a Medicare Advantage plan might, because with a Medicare Advantage plan, there's still going to be copays or coinsurance, and those can vary widely depending upon the services or treatments that you need, and of course the plan that you choose. Now, if you'd like to learn more about Medicare Advantage versus Medicare supplement plans, I will put a video that goes more into depth at the end of today's video. Of course, if you have questions, you can reach us in the comments below or at the number on the screen. Or if you'd like assistance enrolling in a Medicare Advantage plan or any type of Medicare or health insurance, you can reach us at the number on the screen. We're licensed health insurance brokers, we're licensed nationwide, and there's absolutely no charge for our services. Now, as I mentioned earlier in the video, there has been a lot of buzz about Medicare Advantage plans and Medicare in general, and we do expect to see more and more changes in the months and years to come. So please make sure to subscribe to stay up to date. We do release these videos on a weekly basis, and please make sure to like this video so we can get this information out there. All right, let's get to those plans. So here we are on Medicare.gov. At the time of the recording of this video, we're still in the government shutdown, so you may or may not see this message when you go to enroll. Scroll on down to where it says Find Health and Drug Plans. Click Find Plans now. Scroll on down, we are looking at plans for 2026. You're going to put in your zip code. Now we are looking specifically at Medicare Advantage plans. Of course, if you were looking at a Medigap plan, also known as Medicare Supplement Plan, and you wanted to add a Part D plan for prescription drugs, you would click that. But for the purposes of today's video, we are looking at Medicare Advantage. Find plans. It's going to ask if you get help with your Medicare health or drug costs from any of these programs. Medicaid, because if you are eligible for Medicaid and Medicare, you would be known as dually eligible and therefore eligible for a D-SNP. It's also going to ask if you get help with supplemental security income, Medicare savings program, or extra help with prescription drug costs. We're going to click I don't get help from any of these programs. Do you want to see your drug costs when you compare plans? Absolutely. Now, not all Medicare Advantage plans offer prescription drugs, although most do, which we will see in just a minute. So, that being said, it is very, very important that you have your list of prescription drugs and the dosages available to you when looking at Medicare.gov to really be able to fully utilize the website. We're going to put in a couple of different prescriptions here. So, I'm going to put in Lipitor. I use this example quite frequently in our videos because very often this medication is not covered by Part D plans. Lipitor does have a generic. If you're able to take the generic, of course, that's going to save you a lot of money. But for the purposes of this video, we're going to keep the brand. We are also going to add another common medication, which is a generic. And one more common medication, which I'm going to use, let's spell it the right way, which I'm going to use a medication that is another brand name, but one that is more frequently covered. We're going to keep the brand. Done adding drugs. It's now going to ask you to choose 5 pharmacies. I highly recommend that you select a mail order pharmacy and then select some pharmacies that are in your area, ones that you feel that you might frequent. For the purposes of today's video, I'm going to use some bigger chains as well as some pharmacies that I don't really recognize. That way we get a better idea of what things would look like with those larger, more likely to be in-network pharmacies or preferred pharmacies versus out-of-network pharmacies. That should work. Now, if you already have your doctor's names, then you would want to go ahead and put in your provider to make sure that they accept your plan. You can also simply ask your doctor. We're going to discontinue to view plans. Give it a moment. There we go. 10 of 56 plans. Now, up at the top, here's your filtering tools and your sorting tool. So here are the things that you can filter by and the ways that you can sort. So first and foremost, let's look at some of these benefits. These are some of the more commonly added benefits. So if you know you absolutely need dental coverage, Although, if you really do need dental coverage, I certainly wouldn't select a Medicare Advantage plan based on that, because very often the dental coverage isn't really top notch. You might be better served adding a private dental plan instead. But if you absolutely needed it, then you would go ahead and click that and, of course, apply. Insurance carriers. This one's very important. So, Medicare Advantage plans, like Medicare Supplement plans, are offered by private carriers. However, unlike Medicare Supplement plans, with a Medicare Advantage plan, you need to operate within a network. And those networks with Medicare Advantage plan can be rather restrictive. So if you know that your doctor accepts Aetna, Blue Cross, Humana, United, then you might want to go ahead and click some of the carriers that your doctor accepts to make sure that you stay in network. Drug coverage. Please choose a plan that includes drug coverage. You're going to see here almost all do. Let's just look at this real quick. So there were 56 plans available before. Now we're looking at 43 with prescription drug coverage. And it really doesn't affect the price very much. So please go ahead and have a plan that includes prescription drugs. You can also look at star ratings if you'd like. Here's some more filters. So HMO versus PPO. A PPO will give you much, much more flexibility. So I highly recommend that you go for a PPO. Plan benefits we already discussed, insurance carriers, prescription drug coverage. We'll leave that on for right now. Okay, now let's look at how to sort the plans. You can sort by lowest yearly drug deductible, lowest health plan deductible, because very often they're separate. We'll see that in just a moment. Lowest drug plus premium cost, or lowest monthly premium. It automatically goes by lowest drug and premium cost because that's really going to give you the best snapshot of your yearly costs. So we'll leave that for right now. Let's scroll on down. So right now it's looking like this plan is going to be our most cost-effective option. It has a $0 monthly premium, but that doesn't include the Part B monthly premium. You do need to continue to pay for that. Total drug and premium cost, $5,766.24. We will look into this in just a moment, and you're going to see where that number comes from. Because if you scroll down here, other costs, your health deductible is $0. Your drug deductible is $370. That means you need to meet $370 out of pocket in prescription drug spending before your insurance begins to contribute to the cost share. Now, that is only, of course, for those drugs that are on your plan's formulary. And the maximum in and out of network spending, $6,900, or if you go in network, it's $5,400. That's because this plan is a PPO. If I were to look at an HMO, here we go. You'll see that it only is going to say an in-network out-of-pocket maximum, because if you were to go out of network with an HMO, there is absolutely no coverage. With a PPO, you have the option to go in and out of network. In-network will, of course, be less expensive, but you still will have coverage out of network. Now, over here on the right-hand side of the screen, you will see some additional details that you get sort of a snapshot of. If you click here, right where it says Plan Benefits, these are some of the most common add-on benefits that may be offered by your Medicare Advantage plan. So if it's got a check, that means it's included. If it's got an X, that means it's not. So you get just really a snapshot of what some of those additional benefits might be. Here's also your copays and coinsurance. This is just for your PCP, your primary care physician, $0. A specialist is $30. And a check here, of course, that this includes prescription drug coverage. Now, if we had put in our provider, we would see that here as well. Now, one of the best things to do when comparing Medicare Advantage plans is, of course, to use the comparing tool. So let's compare a PPO, an HMO, and let's see. Let's do this one just to make things easy. We will click Compare. So now here are some of the more important details listed on the left-hand side of the screen with the specifics listed under your plan. So this was that first plan that it was suggesting to us. So star rating, this one's too new. Health deductible, they all have a $0 health deductible. Drug plan deductible, they all have varying drug deductibles. This one's the lowest, $370. Maximum you pay for health services, $6,900 versus $5,400. $8,900, $10,000 versus $8,000. No additional monthly premiums, although some plans do have an additional monthly premium. And then that drug premium is bundled in. Standard monthly Part B premium. Now, this is something additional. So sometimes you will see a plan that offers a Part B reduction, so you can actually pay less. And if you are someone that is really tightly squeezed financially on a monthly basis, then this might be something that you need to look into. But remember, they're going to make that money back somewhere. So as you can see, this plan doesn't offer that reduction, but it's got a really low, or at least low comparatively speaking, their out-of-pocket maximum is low and the deductible is low. Now, when we compare that with these two plans, which do offer that reduction, well, the out-of-pocket maximum is much higher and the deductible is much higher. So something to bear in mind. You may be able to save on a monthly basis, but it may come back to get you when you need to actually utilize your insurance services. Here you can compare the additional benefits offered. Here's those costs for specific services and visits. Let me see something here. Oh, so this is the HMO, that's why, because it's not showing you those out-of-network costs. But if you were to compare here, let's see, $0 to $20 copay, $0 to $40 copay. Out-of-network is either a $0 to $20 copay or a 20% coinsurance. Pretty similar. Let's see. 75. Yeah, not a huge discrepancy here. This may be where we see some significant differences. Let's see. If you had to be cared for in a hospital, days 1 through 6, it's $325 per day. This is $440, but it's only for days 1 through 4, and then it drops down. Same thing for this one, days 1 through 5, though. So that's pretty much a wash. Out of network, pretty similar. Let's see. Outpatient hospital coverage in network. I mean, it obviously is more, but it's not drastic. I'm not talking about double. Continue to scroll on down. Prescription hearing aids. It's a nice benefit, but that being said, there have been great leaps with those over-the-counter hearing aids now available, so maybe not necessarily something to make your decision based upon. Dental care. It looks like these all offer dental. Again, this is an HMO, so only in-network, and that is going to really, really restrict you with regards to dental coverage. Eyeglasses. Okay, now let's talk about these prescription drugs, because you are seeing some very high numbers here, and really what we're looking at is that Lipitor. It tends to push us out of our formulary. So let's look at the plan details here, and I guarantee that's what we're going to see. Yep. Covers 2 of 3 drugs. So this big number has almost entirely to do with the Lipitor. Let's scroll on down. It'll take you automatically there. So let's take a look. So those other medications that we put in have no copay, which is wonderful. Even though this one is a brand name, it's probably a tier 2 brand name. We'll take a look at that in a moment. The Lipitor isn't covered at all. That means it is not on your plan's formulary. So no coverage. You have to pay full price. That's why you're seeing this huge number. Now again, if a medication is not on your plan's formulary, you'll see some of these facts and figures, but it does not count towards your deductible and it does not count towards the out-of-pocket max. So you're on the hook for the full amount regardless of how much it is. I'm going to scroll down. Where are the tiers of medications? Is that here? No, maybe need to go back up. Let's see. Medications, in-network. These are all in-network. Sometimes you'll see something that says in-network preferred, and then it'll be even less expensive, but it's all $0, so it really doesn't matter. This breaks it down by month, what your monthly cost would be, including the mail order pharmacy. View more drug coverage. Here we go. So, tiers of medication. Now, this is important because these are the medications that you're currently taking, but maybe you'll end up having to take something additional for a short period of time or for an extended period of time. So this plan has 5 tiers of medication. For a preferred generic or a generic, it is a $0 copay in the initial coverage phase. That means after you've met your deductible. For a preferred brand, it's a 19% coinsurance. Non-preferred drug, 25%, and specialty tier is 28%. Now, even though these percentages are not that high, if the medication itself is hundreds or thousands of dollars, that can still be rather expensive. Now, if you continue to spend and the drug is on your plan's formulary and you reach the catastrophic coverage phase, that is your out-of-pocket maximum for your prescription drug spending. And at that point, you would have no copay because your insurance carrier would take on the remainder of those drugs that are on the formulary, the cost for those for the remainder of the calendar year. This goes into further detail if you want to check a little bit more. I highly recommend, though, that you actually go to the plan's website to look at their formulary because Medicare.gov is a great source. However, it's not always totally 100% accurate when it comes to the medications, and that is really so very, very expensive. See if there's anything else that we'd like to know here. It's all some of the same stuff that we've already looked at. Oh, something to discuss with Medicare Advantage plans. You will often see, actually always see, that it says limits apply. Advanced plan approval required. That means pre-authorization. That means that not only does your doctor need to recommend it, but your insurance carrier needs to approve it. This is a huge hurdle when it comes to Medicare Advantage plans, although there is some hope with some of the changes on the horizon that the pre-authorization process may become more smooth in the years to come. Let's see. So there are a few more things that I want you to look at. Of course, you can go directly to the plan website, but let's go on back. If you wanted to enroll, you could click here at this point, but we're not getting that far today. Let's go back to plan results. I want to show you something else as well here. Let's see. Include special needs plans. So if we wanted to look at D-SNPs or C-SNPs, here we go. Then we could look at those as well. These plans are only for certain qualified individuals, though, okay? Usually we're talking about C-SNPs or D-SNPs, I-SNPs, but you have to live in a specific facility to qualify for an I-SNP. So if those were the plans that you wanted to learn more about, you could look at those as well. Generally speaking, a D-SNP, even though it's a Medicare Advantage plan, could be comparable to even a Medicare supplement plan because it's going to offer you all of the benefits of Medicare plus the full benefits of Medicaid as well. And it really is going to give you the best bang for your buck. If you do want to stick with a Medicare supplement plan, then you may want to look into a Medicare savings program that can help you with your Part B costs, possibly your Part A costs if you're someone that does have to pay for Part A because you're continuing to work to meet those 40 quarters. Or it'll also help with that extra help, which is Part D. Then there's C-SNPs, which are for people with certain chronic conditions. These plans are tailored towards those chronic conditions. So that's just one other thing that you need to know about using Medicare.gov to find the best possible plan for your needs.
Now remember, the AEP is from October 15th to December 7th. So if you are interested in a Medicare Advantage plan, please make sure to enroll or make an appointment with your broker as soon as possible. Of course, if this is your first time with a Medicare Advantage plan, you may still be within that trial right period if you decide that Medicare Advantage is not right for you. If you have any questions, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. And of course, please make sure to subscribe to stay up to date and like this video so we can get this information out there. Thank you so much for watching, and we'll see you next time. Bye-bye.